Hello friends, this is Dr. Deepak, President of Ayurvedic Cancer Research Trust. Now, what we are doing here is creating a new awareness regarding disease and the way it is presented in the market. Now there is a lot of things that people, or rather it has become very difficult to convince people to understand what the reality is all about. Anyways, we'll come directly to the topic. We have got our website, which is www.cancerdoctor.co.in. You can log in and you can see many informations, many research papers which I have uploaded, and another channel which is Ayurvedic Cancer Research Trust channel on YouTube, which will provide you with all this information, all other information, all other videos which you can see there. Today we'll be talking about kidney failure. Now, what do we understand and how do we understand? Why do kidney fails? That's the first question. We'll try to answer this question. Kidney fails. Now, why? There are five major reasons which are given not by me, but through the researches which I have gone through, the major scientific researches, which proves that the first reason is when the blood supply to the kidney is suddenly interrupted. That's the first reason. The second reason is when the kidney becomes overloaded with certain toxins. Let's understand the toxin. Any substance which causes harm to any cellular organ or cells or tissues of our body is what is considered as toxins. Okay, because the modern scientific people usually do not consider any sort of toxin according to their understanding, but yeah, according to our understanding, any molecule that causes a harm, any kind of a harm to any tissue or organ or cells of our body is what we consider as toxin. Now, the third point, we'll come to the first point is when the blood supply to the kidney is suddenly interrupted. The second point is when the kidney becomes overloaded with the toxin, and the third point is the complication from surgeries in which the kidney are deprived of normal blood flow for an extended period of time. Now, here to give an example, heart bypass surgery is an example for this such procedure. There are many others. Okay, now we'll go to the fourth one. Fourth one is over doses of drugs, which are the normal cases which I have seen in my clinical practices. Overdosing. Many of the doctors usually gives the overdosing. Their main reason is if this antibacterial does not work, the other should work. So they will give 2 to 3 antibacterials simultaneously. And even the painkillers. Now the combination of painkillers you already know. The paracetamol is combined with the nimesulide, which is nimesulide is already banned outside. Para with diclofenac and the ceratopeptides, and all the ibuprofen combination with paracetamol, tramadol in combination with paracetamol. So these are the overdoses, or rather the accidental, or I'm just elaborating the fourth point again. Drug overdoses. Now, drug overdoses, it could be accidental or from chemical overload of the drugs such as antibiotics or chemotherapy, as I have already explained. The fifth point is overuses of analgesic, which is very prevalent, everybody knows in today's one. Now here, the second point, we'll go to the second point, which is, can it be regenerated? I mean, this is the second question. The first question was what is and why do the kidney fails. Now there were 5 points which I have elaborated just now. Can it be regenerated? Well, my understanding says yes. and my research. Let me elaborate the point. What when I call research, what is this research? Research is nothing but whatever I have gained through years and years of laboratory experiments which are being conducted at several places around the world. They are published and they are available on the internet. People do not bother to read it. They will only read what comes to the directives of most of the organizing or organized system, like American Medical Association and the rest of other bodies. Yeah. So can the kidney be regenerated? Yes, it can be. Now I'll quote certain sentences which are which were from a paper which is natures.com, paper news from natures.com. What it says is the team led by organ regeneration specialist Herald Watt started with the kidneys of recently deceased. Let's now he is using rats over here, rats, and used detergent to stripe away the cells. Now see here, what he did is he took the kidney cell and he used the detergent, okay, detergent, to wipe out all the cells, leaving behind the underlying scaffold. Now here understand, to give you a simple example, you can understand those you understand as a, okay, leave it any which is, leaving behind the underlying scaffold. So a scaffold is nothing but its outer structure, the connective of the connective tissue, such as the structural component of blood vessels. So structural component of blood vessel plus the connecting tissues which are left behind. Okay, now what happens then? They regenerated the entire organ by seeding this scaffold with two cell types. Now they have taken human umbilical vein cells to line the blood cells. So they have taken human understand this, human umbilical vein cells to line to, so what they have done to line, as in like they have dropped it inside that scaffolding to line the blood vessels for the blood vessel to be regenerated. And kidney cells from the newborn rats. Now kidney cells, the kidney is removed from newborn, and those cells are newborn rats to produce the other tissues that make up the organ. Okay, the work is described today in Nature's Medicine. Ott and his colleague developed this method in 2008. Understand this, 2008 this was successful, and he since used it to grow heart and lungs too. Now isn't it sound simple? You do it in a laboratory outside. Now, this human laboratory, you have such a huge human laboratory, and you cannot regenerate it. I do not understand how, but anyway, just like this. Now the scientist can grow a full-blown organ, fully functional, and our state of art, our state of body cannot generate it. I don't know why. So here we'll answer the question why we cannot generate it. Because no medical system is using detergent towards the toxin accumulated in the kidney. Understand this fact. See, kidney destroys because there is an accumulation of certain toxins, unwanted molecules which are harming those tissues. They need to be removed, washed out. And here we cannot use the same detergent which was used because it was outside. Now yeah, what is a detergent that we eat? Okay, so, and these detergents are nothing but all the antioxidants, like green tea, blah 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 blah, all the shits, whatever antioxidant, whatever we say, all these antioxidants. Whenever you say this contains antioxidant, that contains antioxidant, this antioxidant is nothing but your detergent for the body. Instead, medical system is keen on cleaning the blood and not cleaning the kidney and replacing it when it's completely. This is the state of affair, and that is the reason we are not getting cured. Now, why do mainstream medical fraternity shy away from the truth? Well, there are many honest doctors do not know much about the research on the understanding the body functions. They do not. They are just provided with whatever information. They just follow the protocol laid down by the medical regulatory authorities. The other method of treatment is financially not at all beneficial, like not at all beneficial, as like if you say ask people to go and drink green tea, it is not beneficial to the doctor or the medical system or the pharmaceutical system, but it is beneficial to the farmer who is growing the green tea. Okay, so why do the doctors from the alternative system of medicine, Ayurveda, homeopathy, Unani, Siddha Chikitsa, and all those medicine fails to provide the correct treatment? There is a simple reason for it. Most of the doctors from the alternative medicine are ignorant about the functioning of the body and the action of their medicines. Yes, they are, and this is very true. Okay, and second thing, they are not legally protected. So legally they are not protected by law. So due to the defamation, or they do not dare to treat patients. Yeah, another hand me. Okay, so they're not protected by the law, and that keeps them away from getting into this fraternity. Okay, so I'll log out now. I'll sign off for today. We'll continue with other diseases in the upcoming series. Okay, thank you. Good day.